Hello everyone, welcome to the very first in a new series of webinars from Sport England, where we'll be sharing the emerging learning from our local delivery pilots. My name is Ruth Aline. I will know many of you, I think, dialing in, and you're very welcome, and it's really good that you've joined us today. Last November, some of you may be aware, we delivered 3 community of learning events across the country where we engaged with around 200 actually stakeholders from across the country to share, as I said, the start of our emerging lessons from the local delivery pilots. And we drew out in those sessions some of the commonly occurring themes from the pilots to date, which we think are of significance and are relevant and useful for other partners across the sector to be aware of. Today we're going to share those lessons again with colleagues, so if you weren't able to join the workshops in November, you will hear in a moment from Chris Perks, our Executive Director of Local Delivery, and Naomi Shearon, our Strategic Lead for Market Insights, who will share with you the context of the work that we're doing and the emerging lessons. So before we get underway, just a couple of housekeeping points I want to raise. First of all, we would really welcome questions from you all as we move on with the webinar. And you'll see on your screen an Ask a Question tab on the right-hand side of your screen. So that is where, during the webinar, you will be able to log any questions you have for us. And we will attempt to get through as many questions as we can at the end of the 2 presentations from Chris and Naomi. So hopefully we'll have time at the end for a number of those questions. The second thing, just to point out to you, that if you do have any technical problems during the webinar, sound or anything like that, you have a Test Your Connection button on your auditorium page, which will allow you to see your connection status, and also you can ask any questions and someone will help you if you are experiencing technical difficulties. I hope you don't, but just in case you do. So let's crack on now with the actual presentations, and I'll introduce Chris, who's going to set the context for us of the local delivery pilot work.
Hello, I'm Chris Perks and I'm the Exec Director at Sport England with responsibility for local delivery. It's great to be engaging with so many of you on this webinar. My job today is to set the scene for our emerging learning about our work with in and around whole systems. The 3 things I want to cover are the challenges and the opportunities that we all face in terms of sport and physical activity, the local context in which we find ourselves working, and then thirdly, an introduction into really what is whole system change, whole system thinking. And that will be an introduction into Naomi's session where we talk about our emerging learning. On the actual workshops that we held last year, we engaged with over 200 different delegates, and it's great to be engaged with many more today. Delegates are from a variety of places and circumstances, and I guess our common cause really is our belief in the value of sport and physical activity, both in and of itself, i.e. that being active is a good thing, but also, of course, increasingly in terms of the wider outcomes that being active can deliver. I guess this is what binds us and what we believe and draws us to a discussion like today. But I don't think it's just that. I don't think that's the sole reason why we're engaging on this topic or indeed in the workshops. There's clearly a desire to learn, reflect, improve, and really to respond to the growing interest in how to work systemically and how to work as a system and how to work in the system. I don't think this just is about the issue of scarce resources locally and investment locally. It's very much a growing trend, which is if we're really to achieve something different in terms of participation levels, whether it be sport or culture more broadly, we have to think more holistically about the influences around people and their communities. And we think very much these are questions about the how as much as they are questions about the what in terms of what we'd actually do. If that's our common thread, what's our common challenge, our kind of macro challenge that we all face in terms of participation and engagement? Because there's never been a better time really to look at working collaboratively and the role that you as leaders in the sport and physical activity system can play. And I just wanted to say, I think we should see ourselves as all being leaders if we choose to, and not confuse ourselves that somehow being a leader is about being someone with seniority or power. Yes, that's important, but we are all cogs in the system and we all have power and influence and resources. But it's very much a choice, i.e. we can choose to behave in that way and to lead in that way, and I'll come back to that later on. But just looking at the slide, it's great, it's really great that 75% of our population are active or fairly active. And I really want to thank you for the work that you and others do in terms of sustaining and maintaining and improve that. But I guess the real challenge is that 25% roughly of the population are doing less than 30 minutes a week, or what we describe as being inactive. And I guess that's another really strong thing that binds us together, our focus on those that aren't engaging for a variety of reasons. And I guess it's also that 25% where the gains to be reached in terms of broader outcomes are the greatest. But I'll just say one thing about the webinar and the workshops that we held. We're not going to be discussing kind of delivery, actual activities and interventions and how things are done in that respect. We are very much going to be talking about the broad influences and the environment in which that is done and how that is challenged by system thinking. Just to look a bit more specifically at the inequalities, I mean, the title of the slide is that certain inequalities clearly are stubborn, and we know that 75% of the population are active, and we know that whether it's income levels or disability, that's not the same for other groups, because it's locally where the stubborn inequalities in participation, particularly in terms of lower socioeconomics, are most vivid. And it's where those challenges can be seen, the challenge of personal income and low income. And it'll be in some of your communities and some of your places where you work, where you too can see this challenge about stubborn inequalities. So one of our challenges is that this is about behaviour change, yes, for the population, but in particular for certain key groups. And the truth of it is, the hard truth of it is that the inequalities, particularly around socioeconomics and income, haven't really shifted over many decades, and in many respects, by some measures, are getting worse. The challenge of inequalities in terms of participation and engagement are often compounded by local circumstances. The slide is a picture of one of our pilots in Withersea, in one of the parts of Withersea where they're working, which is a challenging and tough environment. And of course, depending on which part of the country you are from and where you operate in the system, you will see more or less of these big issues facing people, their communities and the local system. Local authorities, of course, are still by far the greatest investment into what you might describe as community sport and physical activity, and they clearly continue to have some real and consistent challenges in terms of future investment. But if you talk and spend time in and around local authorities and you talk to leaders, there are some big macro challenges facing them and their communities. The challenge of housing, the challenge of social care, the ongoing challenge of resources, as I mentioned, and the increasing challenge of balancing kind of financial and social objectives, along with the really here and now issues about facilities and their future. So there are a number of big issues facing local communities, many of which you will recognise, into which our challenge of participation exists. Just to build on that, I think there are three other specific challenges to our system which, in terms of setting the scene, are worth flagging. The first one is described as the empathy gap, You may have seen or heard recently quite a challenging article written by a highly regarded figure in the industry who really questioned why, in particular, inequalities in participation had stayed the same over 30 or 40 years. His theory was that despite our best intentions and endeavours, and not for the lack of policy investment, there's another reason why, another factor, another influence why we haven't made the inroads into participation equalities we may have wanted. And he described this sense of an empathy gap, that, being blunt about it, there's something that we don't quite understand about the lives of people who we're trying to reach, that does affect about how we go about it. Now, there are different subscribers to that idea. We could debate that. I'm sure we will debate that. And it may be about people not lacking empathy, but actually the way in which they work, the system in which they work, the decisions in which we all work, somehow don't bring that in, that somehow the empathy is left at the door almost. And I think, moving on to the second challenge, we really do operate in a fragmented system locally. You will know for yourselves that inside sport and physical activity and outside locally, there can often be a bewildering array of organisations involved, agencies of all levels. And I think that brings both strengths and weaknesses. Traditionally, of course, local authorities have always played that key coordinating role, but that's not always the case anymore. And if you just think about the education system, with the plethora now of different types of schools, or the health system locally that could, is often in a state of reorganisation and change, this makes the environment in which we work full of opportunities, and the variety in itself isn't a bad thing, but it does and can make real collaboration hard. It can make learning, sharing and changing practice hard. And then I think the third challenge facing us as a sector, building on the local circumstances and building on fragmentation, is really about leadership. And I touched on this at the start. We recently have started to run some leadership programs jointly with the local government association and organisations like CLOA and Sporter. And it's challenging stuff about when you really delve into the kind of leadership and the leadership behaviours that are needed in order to bring about real systemic change. We've been really surprised and pleased with the volume of interest in this, thinking actually that the leadership work in sport, physical activity, was somewhat of a crowded market in terms of providers and courses. Well, clearly there's a real appetite for that kind of leadership work. And of course we can choose to take up the leadership challenge, can't we? We don't need to wait to be asked. We see leadership more and more, not as a role that's given to you, but as a set of behaviours right across the local system that can really drive local change. And that can be powerful and it can be sustainable if we choose to let it. So where does that lead us to? How do we support people to be more active? Why have we developed the local delivery pilots, and why are we talking about whole system change, whole system thinking and systemic change? And I'm going to try and explain this very simply and straightforwardly, because we believe firmly that when you start off with the needs or wants or aspirations of people locally, when you really start off with a tacit and good understanding of the barriers facing people as to why they're not active, that really does compel you to think about the variety of influences and factors that come together around people and around their communities that do or don't make activity a good or an easy choice. So it is about those variety of influences around people and communities that really help or mitigate it against people being active or the likelihood of them being active. That's a really simple explanation of whole system approach. The circles diagram on the slide is something that many of you will have seen, and there's lots of different formats. We think this is a really useful way of conveying what we're talking about, that actually you need to think systemically and systematically about a range of influences. Yes, the individual, but others such as policy, environment, and the organisations and institutions that create the environment or not for help people being active. We haven't invented this. It's not our model, but it's certainly what the local pilots are exploring at pace and in some depth. Just to say as well, we think we're in good company in terms of this thinking. The slide just quotes from the World Health Organization Global Action Plan on Physical Activity. You will all know this challenge for yourself, but that seems to be quite a good short summation of where we are, that going forward we do need to think more systemically and systematically and holistically around the reasons why people are or they're not active. And the truth of it is, just looking at the next slide entitled The Building Blocks of the Pathway, quite a lot is written about almost the theory of it, but not a lot written about actually doing it. And I guess that's the real substance of today and the emerging learning that Naomi is going to talk through in a second. We're on a journey with 12 local pilots and a few other places, and I hope with you as well through this webinar and our future contact. This is real work in the real world, which we're sharing today. And I'd say right up front, this stuff isn't easy, and it's sometimes not quick in terms of trying to bring about real systemic and sustainable change. We have a really strong commitment to share this, hence the webinar and previous workshops, which we wouldn't normally do. Our whole premise here is that we need to be sharing this, both the successes and the challenges and the failures indeed, as we go through it. And we need to be sharing that in a real way across the system and the sector if we're really about bringing about systemic change and change in practice. We're really genuine about that in wanting to work differently. We started to develop, in fact the pilot's been working for a while now, a kind of pathway which details some of the key ingredients for what we think brings about systemic change. We haven't dreamt them up. They've been drawn from a lot of our deep reading, research, engagement with system experts. But the truth of it is, no one has all the answers, and the route to change and challenge going forward is a collaborative approach, hence the session today. So just to finish, we've got that double whammy, haven't we, of not only trying to change the behaviour of potential participants, but also about trying to change the behaviour of those that are working on that too, i.e. us, you and other colleagues. And I was trying to think about a way to sum up the kind of challenge, and I think the best way really is to share with you on the slide this advert which was from the South Tees pilot. They wanted to hold a system day around sport and physical activity and community in its broadest sense, and they used this as their advertising flyer, if you like, to bring together about 120, 130 partners to really have a good and a deep and a well-informed discussion about why some of their communities weren't active and what they might do about it. And it's a bit of an unusual title, isn't it, to see that as a flyer. Something has to change and it's us. But it seems to me it sums up both the challenges and the possibilities of what we're talking about. And I actually attended the day itself, and it really was a terrific exploration of some of the challenges and opportunities that we face. So I'll finish there, and I'm now about to pass to Naomi, who will talk you through some of our rich and deep and challenging emerging learning from our work in the pilots around system change.
Hi, I'm Naomi, and as Chris said, my job today is to tell the story of the pilots at the moment, which I suppose rather disingenuously involves me trying to bring together the huge amount of work that's been going on into a relatively short space of time for you. So the way that this worked in some of our recent learning workshops is that delegates had actually had the chance to hear in quite a lot of detail from some of the pilots about what particularly they are working on and what they've been doing. And then I tried to sum that up into a series of themes that we were seeing across the pilots. And that summing up of themes is what I'll go back over today. And if you like the sound of hearing about the pilots in more detail, then look out for future events because that's something that we'd like to do again. The first slide here shows another version of the onion diagram, as it's become known, that Chris has just talked about, which is also known as the circles diagram, and also the nested model, and the social ecological model, and also the social determinants of health, etc. But it really doesn't matter at all what it's called. It's really just a diagram to convey a very important idea that's at the heart of the local delivery pilots. And that idea is that how active someone is influenced by loads of different things, loads of different factors around them. And they are way beyond their control as an individual, way beyond the limits of their own motivation, and way beyond the control of any single club, school, leisure centre, service or programme. And what that tells us is that to really change how active someone is, or to really change the relationship that communities have with movement, moving more, and activity, we need to work coherently as a system around that person and community. So what does that really mean? Well, it means that if we want to genuinely transform those relationships that people and communities have with activity, we need to sort of turn the telescope around, so to speak, and look less at what is wrong with those people, which of course we don't intend to do, and that's not how we really phrase it. But there is a long and sort of unfortunate history of looking at what's wrong with people so that they don't do the things that we think are sensible to do as sort of policymakers or service deliverers. And actually we need to look the other way a little bit and look more closely at what might not be working for them in the places and spaces and systems that surround them. And that really is, as Chris said earlier, the basic premise of the pilots, turning the telescope around and looking at what might not be working for people and communities so that being active is not easy. And when we talk about this, as we do a lot here at Sport England with pilots, with other partners, I think pretty much everyone seems to agree that it makes sense. But making sense in theory as a way to understand what we're seeing and sort of understand or diagnose problems is really different to working in light of that understanding. So doing something differently because we've recognised that there are these sort of system barriers. Working differently is really, really hard. And this sort of moves us on to our first major learning theme, which is that the pilots have observed a major disconnect locally between the sort of recognition of the importance and relevance of physical activity in improving the lives of people and communities. So just in really plain English terms, everybody essentially fundamentally agreeing that people getting out and about, moving more in lots of different ways is better for happier, healthier communities who are connected. The disconnect is that there is not necessarily the plan to embed physical activity into the business of the place. So just because everyone believes that it is the right thing to do and it is a vehicle for change, it doesn't mean that it is in commissioning frameworks or development plans or the priorities of the place or well represented in the resourcing plans, or that people who really do influence physical activity in their jobs know or recognise that that's part of their role. So really what that means is that sport, physical activity, whatever we want to call it, has often been isolated as a part of a local system, for example, leisure services, rather than an important contributor to the whole. And that means that lots of the things that influence activity levels, who are actively influencing activity levels now, for example, the way that spaces are maintained and designed, or the way that transport helps people to connect to their opportunities, aren't considering their role in that. So this can seem really overwhelming, starting from that position. And the local delivery pilots have been working hard to shift the conversation from how do we make our piece of leisure, work as perfectly as possible to how do we achieve something important for our place as a whole. How can people being out and about, moving more, really change some of the things we all know needs to change around here? So how do we get this into the hardwiring or the DNA or the fabric of what we do? And a lot has been done to demonstrate the power of physical activity and contributing to what matters in their places. Clearly that's an enormous job. And the other thing is it can sound a bit intangible, bringing people together around tables, bringing service leads together to recognise the power of physical activity. But it isn't just a nice thing to do, it's already showing really tangible effects in terms of real changes that people and communities will feel and notice. So an example from one of the pilots, just one example, is that the Adult Social Services team have recognised that there is an opportunity to get people moving and out and about when they visit them. So they can embed some physical activity, whatever works for that person, at whatever level that they can manage, into a process that already exists. And that is a tangible effect of services recognising that there are ways to support each other on what really matters. What we're hearing from the pilots and learning together is just because this is all referred to as whole systems change and sounds very big and complex, it doesn't mean you need to take on the whole system and all of its challenges all at once. So what I mean by that is there's a temptation to try and sort of figure it all out before you make a move. Sort of picture this whole thing and decide all of the things you're going to do to try and transform the place. And actually that's a real risk of systems work like this. And a lot of the literature says that you sort of get stuck in a holding pattern of trying to see the whole jigsaw puzzle and then set about changing it all at once. But where it seems to be working best is sort of the opposite, which is starting with something that is clearly and specifically not working for people, a particular project or problem in a place, and trying to make that work in a really determined and systemic way. So for example, if we want to make this thing happen for those people and we want these things to get better, then we really are only talking about that community centre, those 3 schools, that particular field, that busy road that's hard to cross, those transport connections that don't work. Then trying to do the things that mean that that can come together. And in many ways then all those circles we've talked about with theories and diagrams, they all sort of come out the woodwork. And this has led to a sort of widespread adoption of an important phrase across the work of the pilots, which some of you may recognise as one of Myron's maxims. You need to start anywhere. Just make a start anywhere, but you have to be willing to follow it anywhere. Absolutely everywhere that takes you until it works for the people that it needs to work for. Chris spoke earlier about the empathy gap. And this is something that the pilots have highlighted in their own ways extensively. And that's that it feels like many degrees of separation have emerged between the people who make decisions and take actions that affect communities and those communities themselves. So I do entirely agree that there's not enough empathy in our work. And I think at the workshops, this was one of the themes that was most hotly debated. But the problem felt to be not so much that we're not capable of empathy, or that the more senior you get, the less capable you are, but more that something about the processes we work with means that we don't take empathy easily into our professional lives or the choices we make at work. As Chris said, it's almost something we leave at the door. Something about the way we work doesn't allow room for empathy. And we've seen a lot of this coming through the stories of the pilots. So the ways to connect with residents and communities are not often well established or known by people running services. And where they were once there, they are often diminishing. So the ways to connect are fundamentally diminishing. And the way that community consultation, when it does happen, typically works, isn't actually providing people with the opportunity to meet people, hear their different perspectives, take decisions based on empathy and understanding. They're typically becoming more narrow. So, for example, communities are consulted on a particular subject. They're asked particular questions about their bins or a sports field. Or they are distancing in methods. So we procure together an agency or an expert in consultation who runs a series of events for us over a series of months. They make the relationships and hear the stories, and then that comes back in the 25 PowerPoint to decision makers. So this sense of the conversation is narrow, the method is distancing, the opportunities to do that anyway are diminishing. It's making this empathy gap bigger and bigger and bigger. So the pilots are really trying to confront this and think about how we get to really what's going on in people's lives and the real root issues that are often missed, so that we don't just put sticking plasters on issues or paper over the cracks, that we try and get to the real root issues. And just a story here from a few of the pilots. Hackney particularly have talked about a lot of conversations with residents that have demonstrated that the really popular activities that are happening in communities right now are popular for a lot of reasons, but the main one being that they provide a warm meal, especially the popular activities for children. And people talking about that opportunity to get a meal and meet people in a safe place as being the most compelling part of that opportunity to do activity. And, you know, this idea that you may be talking about helping people get more active, but when you start talking about the choices that some people are making, you know, between heating and eating, you're having a really different conversation and you end up in a really different place. So the local delivery pilots have been exploring ways to bridge the empathy gap and reduce the distance between communities and the parts of the system that are there to support them. They've been doing that in lots of interesting and creative ways. So I'll reference Birmingham with a lovely example of going into libraries with cartoonists and talking to families, individuals, parents and children, and offering them the chance to have a caricature of themselves and their families drawn for them. And in those moments that somebody is sat, listening, being drawn, having just a really natural conversation about how people feel about their communities, about the opportunities to get out, to get moving, like some of the things that are bothering them, in a way that doesn't feel as artificial as focus groups and formal consultations. And then somebody getting something nice at the end of that conversation that they value. So our next theme is that a central part of working in a more systemic, joined up, interconnected way is an enormous mindset shift away from, in many ways, the myth of command and control. So the pilots have all been talking about how challenging it is once all of the people and things that influence physical activity start to become clear. It can be really messy. And the challenge there is that there's a temptation to try and take control in the ways that we traditionally would, to try and harness that messiness, sort of cutting things and people out of the equation to make it more manageable, or putting more sort of layers of bureaucracy in to manage those relationships. But the local delivery pilots are recognising that actually that messiness that's emerging, all those relationships and connections, are really the beginnings of something happening, of change. And the way that the pilots have spread in terms of the nature and scale of their relationships and the places already is profound. Just many more people involved in conversations, recognising that they are delivering similar things, that they could share resources, that there are ways that they could support each other. And that means that there needs to be really different ways of working and resourcing that allow for flexibility to change, allow for things to emerge naturally from conversations and communities, for opportunities that appear to be seized, which is really different than a sort of linear planning and development and delivery process. And it challenges in many ways the way that we've project managed things, resources and people for a while. So it involves serious project management, but more agile and not as linear as we're used to. And many pilots are meeting this sort of complexity with simplicity and thinking about when things get complicated, what are the simple rules, what are the mantras, what are the principles that we always go back to. And just one example from one of the pilots is, let's continuously ask ourselves, will doing this help an inactive person get more active? If we feel like we're being distracted by something, do we really fundamentally believe that going down this path will make a difference for someone, a real person? And again, this is an example of how starting to work this way by making a start on one area or audience or problem can help to build solutions without the overwhelming task of taking everything on at once. So a good example here is Grace in Manchester, who have the overwhelming task, really, of trying to allow for the flexibility of 10 local authorities to do what's right for their relationships and their communities, but with some cohesion and some shared principles and ways of working. And they are doing just that. They've created a sort of framework of agreements about how this is going to be done, but then left a lot of flexibility where it's necessary. So as Chris mentioned earlier, emerging from the pilots, there is some idea that's being shaped around the sorts of steps or ingredients for working in a more systemic way around physical activity. And I'm mentioning that again, not to duplicate what Chris has said, but to reassure delegates that there is some structure to this, sort of a bit counter to the last theme because it can sound a bit chaotic. But there is sort of a spine of thinking and a spine of structure that runs through the pilots. And that is emerging, and we're adding to it all the time, and soon we'll be in a position to share that more widely. And there's a lot of guidance around the steps that could or should be taken to change a system or take a more systemic approach. And many of them are helpful and can give ideas about what working in this way might look like compared to the ways we're perhaps typically used to working. But increasingly, we're learning from the pilots that the way in which these steps or tasks are done is the thing that makes the biggest difference in terms of how successful it is. So the tone, the style, the empathy, the human elements of the approach is what makes the difference between whether it feels like it's really connected and impacted. So that is something that's challenging to talk about and really challenging to get your head around. But if I can sort of try and make it feel a bit more tangible, there's a reflection on sort of the over-professionalisation often of the services that we work in. So this idea that we have met this enormous complexity with ever more bureaucracy. So the more complicated things get, the more rules we institute. And the more rules they are, the more bureaucracy there is to surround that. And this recognition that actually a lot of the processes we work with are there for duplication, consistency, continuation, and really, in essence, to make it more likely that every version of something we do is like the version of that thing we did before. And actually, that can stifle creativity and innovation and relationships. So we've been learning what ways of working connect more people to other people, other perspectives, a shared sense of what matters, and an ability to really take opportunities, follow energy for change, and not stifle relationships, people, opportunities with some of the rigidity that we've created in our systems. And then sort of the final learning theme that's perhaps unsurprising, I don't think anyone will be surprised, is there's real tension emerging between this new and more systemic way of working and the established ways of doing things. So these tensions are real, and they're being felt strongly by those people working on the pilots, taking a lot of sort of personal resilience. And in many ways, they've started to recognise themselves as much about understanding where the blockages are in the systems as about trying to unblock them. And so when the pilots are trying to work in ways that respond flexibly to community needs, new opportunities, new perspectives, changing context, changing circumstances, the rigidity of the existing system can present real delays, and that can create real frustration. So that's transpired in the local delivery pilot places and also in Sport England's own processes. This is something we are confronting ourselves as a funder. And the local delivery pilots have been finding ways to uncover and challenge those long-standing assumptions, sometimes unwritten cultural rules, or sometimes bits of process that maybe aren't so helpful in the world we find ourselves in now. And the hope is that this is some of the most transferable learning to us all, and that some of these methods and fixes and ways to sort of unblock these bits of process that we all find frustrating can be transferable into other situations and places. So an example would be in Withensea, where they've been recruiting people from the local community as the best possible connectors into that community. But that has meant recruiting differently than the current approach and appraising people's appropriateness for roles in quite a different way than the local authority is used to. And their HR team is really working with them on that to think about what that process would be to still be fair and open and transparent, but look for a different set of skills than they're used to looking for. And these are the sorts of processes that feel like they're entirely transferable into other places and contexts, and we will be sharing these. So I just want to end with a sort of a really hopeful note, I suppose, because that can sound all very big and complex. And Chris said at the start, and I don't think we should shy away from it, the transformation of a place's relationship with physical activity and sport was never going to be a quick fix, and we wouldn't be naive to suggest that this is something that would have been dealt with in a year. But I do want to say that there is a huge amount that's already really tangibly changing because of these different ways of thinking about the challenge, of working with other people, of looking for the ways that resources locally can point in some of the same directions, and really consciously thinking about physical activity not as an end in itself, but as a vehicle for wider changes that matter to a place and the people in it. And there's so much potential here that there is the risk that we try and make it perfect and that we all get crippled by the feeling of what this should be. But the pilots are really showing that there are huge strides that can be made by just trying to make it better, by just trying to line up some of those influences and start that conversation somewhere and then build momentum. So really this message of let's not let the perfect be the enemy of the good. This is something we can all sort of start today. And many of the people listening will have already started, possibly a long time ago, trying to line up some of those influences, trying to connect some of the dots. And so I think something that brings us all together is our joint experience of trying to do the best thing for people who need the most help to be active. So I'm going to wrap up the presentation aspect now, and I think we have some time for question and answer.
Okay, thanks Chris, thanks Naomi, that was great. Really good to hear that again, and I hope you that were listening found that useful, especially if you were listening to that for the first time. We have had some questions come in, so we're going to move into a Q&A. We've got about 10 to 15 minutes for these. So the first question we had was from Neil watching from Substance. And Neil's asked, and this is one for you, Chris, can you say who wrote the article on the empathy gap?
Yeah. Hi, Neil. It was written by Martin Allinson, who many of you will know has probably got 40 years' experience in the industry. And it was published on the Leisure Review website. And just to say something about it, we do use and discuss that paper, its thinking, in some of our leadership work, and it really does spark a good and healthy debate about that topic.
Thanks, Chris. What we'll do is we'll find a way of perhaps linking the article onto our community of learning webpage on the website, and I'll come back to those pages in a moment because we have some questions about that as well. So thanks, Neil. Okay, we've had another question come in. Chris, I'll probably direct this one initially to you as well, from Catherine Slater from the Activity Alliance. How are we taking our existing learning from other Sport England funding programmes and using it not only to support the LDP work, but to test out and further influence policy at a national level? So what are we learning from other programmes, Chris?
Thanks, Catherine. It's a great question, because learning and using the learning to improve our practice is absolutely at the heart of the pilot work and the place-based whole system approach, hence today, of course. In response to your question, I would say a couple of things. We're trying to work quite differently in that in the actual places we really are, for the first time we think, trying to make use of our past investment, our learning from that in terms of what works, and join that up and infuse that into the emerging plans and proposals in the places. A real life example would be just this week, a session in Greater Manchester with a range of colleagues from Sport England, sitting down with colleagues from the system locally, talking about very real topics such as workforce development, where we know we need to change and improve and develop our thinking on workforce in locations, and we were able to join that up with colleagues' expertise and aspiration from in here. Secondly, I would say that in terms of connections into other government programmes, initiatives and learning, that's starting to emerge as well. A real example is that in two of the pilots, in Pennine, Lancashire, and in Pennine, Lancashire and Bradford, they are both pilots for integration areas, which is a key new policy from communities and local government department. That's already starting to have real join up with the aspirations in the pilot locally, because their common view about the role of sport and physical activity is developing. And then I think the third thing I would say is, and there's more to do on this, is that there's definitely more to do in terms of drawing in expertise and learning from the broader sector. I know, Catherine, we've talked to you and you've helped us a lot in terms of your approach to place-based work and disability. There's definitely more to do on that front, and I think it will come as momentum grows and the culture of learning and exchanging learning, both what's worked and actually what hasn't worked, grows. Thanks,
Chris. Another question, this time, Naomi, for yourself, I think, picking up again on the empathy gap. Could you give us some of the practical examples of how pilots are actually trying to bridge that empathy gap that you spoke about?
Yeah, there's quite a few, so I'll just give some of the ones that are front of mind that we've been talking about recently. Practical examples, I've talked already about Birmingham and Solihull's example of talking to families in libraries. There's another really nice example from Birmingham and Solihull, which is using community events, so they close down streets and bring communities together to generate ideas and also to vote on those ideas, so community voting, which means that sort of the best ideas, the most important ideas to communities get surfaced out of a lot of different ideas. There's some interesting conversations we're having in Greater Manchester this week at the event that Chris just referenced. So this was with regards to walking and cycling and how walking and cycling around communities can be increased. And so examples there included starting conversations at school gates, so where people aren't responding to formal consultations and surveys and this sort of thing. It's going to school gates and chatting to parents at school gates to try and generate interest and start a conversation and bring people into the consultation process. Walk and talks, that's been interesting. That's come up a few times. It's come up in other projects as well. So there's a piece of work in Wandsworth, for example, where trying to understand how communities relate to the places they live in is really hard in a sort of grey room in a public service building, but it's much easier to just physically get out and walk around the spaces and places that people live in and talk about what people like, what they don't like, what makes life really hard, the parts of the space that people gravitate towards and why, where people go on their daily routines, the places they never go. And that can really help to get into the headspace of what it's like to live somewhere that, to be honest, probably a lot of decision makers don't live in. And other big examples sort of centre around the idea of food and sharing food as a way to just initially bring people together and start conversations. So an example is the Real Junk Food Project, which is an existing charity that intercepts food that would be taken to landfill but is perfectly good to eat, and creates meals that can be served at cafes or in schools. And so the local delivery pilot has connected with that project to start conversations whilst people are just essentially coming together. And other examples of bringing people together for fish and chip nights, again, just to build trust, start conversations. I think the main theme I want to say is it's obvious from everyone that this is not, it doesn't work with one-off events. It's like long-term relationship building, and a lot of the damage that has been done in the past is sort of generating a conversation in a focus group, exciting people around possibilities, and then them never hearing anything else again. It just disappears, and actually it just erodes the trust. So that's sort of fostering a relationship, coming back together, proving that action comes out of it, being willing to take steps. Hopefully that answers the question.
Thank you, Naomi. Yeah, that's really comprehensive. Thanks. Another question that's coming from Neil from Cyclo Consulting, a really good question here. Are all the pilots proceeding at the same pace, milestones? Chris, do you want to comment on that?
Okay, thanks, Neil. Quick answer is no, they're not, for a variety of reasons. We selected 12 pilots that were very different in nature, size, context, history, audience focus, deliberately because we wanted to learn. We wanted a wide range of variables because we really wanted to learn from different situations. So they're not all moving at the same pace for a variety of reasons. They are broadly all working on similar kind of ingredients. I wouldn't describe them as milestones. They're the ingredients we talked about on the presentation, but not in a slavish way, not in a kind of clear formula and sequence. I mean, that's one of the really exciting and challenging aspects of this work, is starting some interesting things and following it anywhere and seeing where it takes you. We're working very differently with them. We're working very closely with them. Our staff, our colleagues are, in many cases, embedded with the pilots. So we're seeing and feeling that in real time. And I would say that, just back to some of our learning, this is about saying yes to the mess, starting something, as I said, and following it. And that's the essence of the piloting approach, I think, that it's not a formula, it's not a blueprint that we all know and understood. Therefore, it just takes twists and turns, and therefore there is a different pace emerging for good reason in different pilots.
Naomi, did you want to comment as well?
Yeah, just to add that certainly different pace, but also certainly common milestones. So I referenced that there's a sort of common spine that runs through the pilots. Hastings call it a process because of everything that Chris has said, but a set of things to do to work more systemically, tasks and bits of process that are really iterative, but it does provide a sort of framework for the pilots to look across together and talk about who has done what, which of those milestones have been reached, in what order, what's working for who, and it does allow at least a common frame of reference for the sorts of progress that pilots are making.
Yeah.
Okay, thank you. We've had a number of questions in around the community of learning itself and how people can actually stay engaged and get involved, and what it actually means to be part of the community of learning. And I'll pick up on that initially, as that's part of my role here with the pilots and at Sport England. And it's a really good question. First of all, we have got our website pages, they're up to date now and will be kept regularly updated. So please do keep checking in on the website for the latest information. We are planning throughout this year to run a number of workshop events again. The next set of workshops will probably be June time. We haven't set dates yet, but as soon as we have set those dates, if you're on our mailing list for the community of learning, you'll get notification of those, and I'll come back to how you can get onto the mailing list in a moment. We've also, as you now know, we'll be running a series of webinar events over the year. So we plan to probably do one every month to 6 weeks, and we'd really like to hear from people like yourselves as to what sort of themes you'd like these webinars to be developed around. And we'll be putting something up on our website, a poll type approach where we can get views from you. So please do stay engaged that way. So those are some of the very practical sort of events that we put on, seminars, webinars and so on. I suppose the other thing about what does it mean to be part of the community of learning is we very much want to make this two-way. Obviously, as you've heard from this morning, we're learning an incredible amount from the pilots, and we're determined to share that as we go along, warts and all, and I think you're starting to hear some of that. But we really also want to hear from other colleagues, partners, who are not a delivery pilot, but who will be doing some of this work, will be thinking in a systematic way, will be working in a place-based way with their own system. And I know there's lots of other learning going on out there. And we do want to create the events and the things that we have moving forward that create a two-way relationship, and you are feeding in as much as taking from the community of learning. And I suppose as part of that, being part of the community of learning, I suppose it's all of us challenging ourselves to how we're working, what we're experiencing in our places, you know, what is our practice like in doing this work, and what are your own reflections of how that work is going locally. So it is events, it is webinars, it is exchanging information, but it's thinking about our own practice as well. Again, on a very practical point, if you're not on our mailing list for the local delivery pilot community of learning and you'd like to be, please do email us at ldp communityoflearning@sportengland.org, and that email address is coming up on your screens, so you'll be able to see that, and do email us if you don't think you're on our mailing list, and we will therefore be able to keep in touch with you. Those of you that are already opted into the mailing list, you will, and if you've opted in to receive information about events and webinars, you'll obviously get regular communication from us about those. We're running to the end now. We haven't had many more questions in, and we're going to need to finish now. Unless there's anything Chris and Naomi want to add in terms of the learning community, I'm going to probably wind us up in a minute. No? Okay. Well, I'd like to thank you all for joining us on our first webinar for the local delivery pilots. I hope you found it instructive, useful, and you've gained from it. Again, if you have comments about today, please do feed them into us through the website, through the address that I've just given you. Do also please check out our local delivery pilot pages on the Sport England website, which we are keeping up to date. So thanks again for joining us, and enjoy the rest of your day. Thank you.